Hi, welcome back to DKMS YouTube channel. Here, we talk about everything under the umbrella of blood cancer and what you could do to help. In our previous video, we spoke about the basics of blood cancer. Today, we're going to deconstruct leukemia, a type of blood cancer. Don't forget to check out our previous video to understand all the basics. So, what exactly is leukemia? Leukemia is a type of blood cancer associated with an increased number of abnormal cells, mainly white blood cells, in the bone marrow or the blood. These abnormal white blood cells outnumber healthy blood cells and hinder the functioning of normal cells. The course of leukemia may vary from a few days or weeks to multiple years, depending on the type. In acute leukemia, it develops fast and manifests within a few days or weeks. And it can occur at any age, childhood, middle, or even when you're old. Chronic leukemia develops slowly and progresses over many years, and this occurs mainly in middle or old age people. Leukemia is further classified into 4 different types. Under acute, we have acute lymphoblastic leukemia that develops fast, and there is proliferation of undifferentiated primitive stem cells, also called lymphoblasts, in the bone marrow, causing failure of bone marrow to produce mature white blood cells. We also have acute myeloid leukemia, that is AML. And this happens when the bone marrow cell develops some mutations in its genetic material, otherwise known as DNA. The mutated cell instructs the bone marrow cell to continue growing and dividing. As a result of that, blood cell production becomes out of control, and the bone marrow starts producing immature cells that develop into leukemic white blood cells called myeloblasts. Under chronic leukemia, we have chronic lymphocytic leukemia, that is CLL. In chronic lymphocytic leukemia, B lymphocytes normally produce antibodies to fight against any antigen, also known as infection. Failure to produce protective antibodies comes under chronic lymphocytic leukemia. Further, there is accumulation of such incompetent B lymphocytes in the bone marrow and blood, which compromises immune function. Lastly, we have chronic myeloid leukemia, that is CML. Chronic myeloid leukemia, or CML, results in proliferation of white blood cells, predominantly granulocytes. The disease occurs due to chromosomal abnormalities known as Philadelphia, that is also PH chromosome. Since this is chronic, it tends to progress slowly. A person with CML can go months or even years without showing any symptoms. Symptoms of leukemia vary from type to type. However, there are some common symptoms to look out for: fever or chills, persistent fatigue or weakness, frequent or severe infections, loss of weight, swollen lymph nodes or an enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, tiny red spots in your skin, excessive sweating, especially at night, and bone pain or tenderness. There are different ways to diagnose leukemia. Some of them include a physical examination, blood tests such as complete blood count, also known as CBC, bone marrow tests, and genetic tests. The treatment usually depends on the type and severity of the leukemia, the age, and the overall health of the patient. However, some common possible treatments might include 1. Supportive treatment, 2. Chemotherapy, 3. Immunotherapy, and 4. Hematopoietic stem cell transplant. In our next episode of Deconstructing Blood Diseases, we're going to take a look at myeloma, also known as Scarlet's disease. Want to become a potential lifesaver? Visit our website and register with us today. Don't forget to like, share, and subscribe to our channel for more informational content. Join us in our journey and follow our social media channels mentioned in the description below. See you next time!